In public health, we aren't just an organization or a governmental agency, we're partnerships.
We partner with organizations that are doing basically the same thing but in different components. So we're kind of bringing them all together to work towards just being healthy rather than just focusing on tobacco or just focusing on physical fitness.
Through our Small Community Transformation Grant, the CDC has given us the opportunity to focus on areas that tend to get left behind. And so through this grant, we're able to come together with other organizations like the Alzheimer's Association and the YMCA to improve public health overall.
We are starting to use a coordinated school health index, so we're going to be looking at more physical activity, what kinds of staff wellness programs they're putting into place.
We do not make a move that's not evaluated, so because we want to know, we're following best practices, so we want to know, are we hitting the mark, are we making a difference?
In Oklahoma, there's been a drastic shift in emphasis, more away from clinical services, although we still provide those, but a greater emphasis on wellness, not treating the person, the sickness, but in keeping that person well in the first place.
It really gives us an opportunity, especially on the city planning end, to turn around and look at how to make great improvements.
Our goal and our mission is to make our communities to where the healthy choice is the easy choice.
We've actually been able to reach into these communities and help these individuals find a way to not only help their current situation, but actually help combat the issue with their family members as well.
Most of the clients that we see, they are Spanish and they don't speak English, and they need somebody that can understand them and be a link between the provider and the client.
And this project really gave us an opportunity to get out into the community and make permanent changes into the way people live, to give them the opportunity for a healthy, long life.
Life expectancy 100 years ago was 45, 50 years of age, and we fast forward 100 years and we have a much better life expectancy, but the big issue that faces us as Oklahomans now is chronic disease.
One of our hugest health problems is heart disease or cardiovascular health in the entire state.
It's a goal of mine to see our state completely tobacco-free.
A lot of what we're doing in our communities are great opportunities for us to share our experiences with other communities across the state of Oklahoma so that our successes can be Oklahoma's successes to make Oklahoma a healthier place to live.
I have a 2-year-old son, and it's very important to me to see these communities become more walkable and livable because I get to see him every day and see where he's going to school and if he's able to walk, and I'm very concerned about the health and fitness level and activity that he's going to be receiving and the proper nutrition that he's going to actually be receiving in schools, and I just want him to live a long and healthy life.
My hope and my prayer for the future of this state and our organizations in our community is that people continue to work to achieve positive goals, to make improvements in their community, to make improvements in their organization, to make improvement in their state.
Moving forward, we have to continue working with private industry, and because we can make a huge difference. Private industry oftentimes has the financial resources, and public health has the data. And when we can bridge that information together, we can make a tremendous difference in our state and our country.
The state alone is not the answer. It's the private sector, it's the public sector, it's all of healthcare coming together.
I think our state is on the right course. We have good leadership, we have good momentum and energy and synergy of activities. Change in behaviors happen over a period of time. So we need to be patiently pushing forward for changes in our community, in our own individual health patterns and behavior patterns. So we should see some good results in the matter of 5 to 10 years in every aspect of what we're talking about today.